Hello, welcome to the Geri Academy podcast with your host, geriatrician Dr. Golnur Sharif Saleh, providing you with information on aging-related topics. Learn more at geriacademy.com and follow me on social media. Hello, friends. I just flew back from Salt Lake City tonight. It's a little bit later. I went there to help my mom after surgery. It's late and this episode is long overdue. I'm going to share with you something that is on my heart and I hope you find it helpful. I promise the podcast episodes on dementia will resume next week, and I promise I will also talk about the new medication for Alzheimer's disease in the upcoming weeks. I have been speaking to the drug company, talking to the research team there, understanding payment, insurance, and I really want to know if this medication is helpful and safe for my patients to use. When I have all of that detail, I promise I will share it with you. So back to the story for this podcast. About a week ago, my father took my mom to the emergency room. They were going to rush her to surgery when my aunt, my very insightful, intelligent internist of an aunt, who happens to be my mom's primary care doctor and lives in Salt Lake City, went to the hospital to speak to the anesthesiologist. After that discussion, they realized the risk of surgery was far greater than the risk of observing her and trying to perform surgery later in a more controlled environment. My mom has another medical problem that could have complicated the situation. But what's interesting is I spoke to the emergency room physician when she was first admitted, and I explained to him and gave him her medical history. But I'm not sure if a critical part of the history was given to the surgeon and the anesthesiologist by the emergency room physician. Thankfully, my mom was stable and she signed herself out of the hospital against medical advice. I mean, no joke, she signed herself out of the hospital against medical advice. She's a retired nurse. She knows a thing or two. She said, "When you doctors figure out what you want to do, I'll be back." I even tried to speak to her on FaceTime, and she said, "I'm not speaking to you. You're one of them." And I now laugh at this, but you could imagine how upset I was at the moment. If my aunt wasn't there, if my mother didn't have a physician who happened to be her advocate, and she had had surgery, there would likely have been more complications, possibly even death. So lesson number 1, your primary care doctor should know you and be your advocate. As most of you know, I have moved to Asheville, North Carolina. I love my job in Morganton. I love it. And, over the next few years, I will be transitioning out of that job. But because I really believe in the hospital's mission and I have such a supportive group of supervisors that I couldn't imagine working for any other hospital system. So I decided to open my own private practice, a practice where I can see my patients if they're hospitalized. I can make house calls. I can perform procedures. I can coordinate care with specialists. I can even go see my patient with, let's say, their cardiologist if I think the issue is that severe. A practice where my patients call me directly when they have concerns. Lesson number 1, have an advocate. The other reason this is important is because a spouse may not be a medical person. They may not be able to explain all of the details. My father definitely wasn't. Now, one thing I need to thank my sister. She actually flew out from New York that very same evening, and she ended up going and spending a few days with my mom before I went there for her surgery. But that support was amazing because I don't think my father would have been able to take care of my mom without my sister. I guess this also could tell you how close the 4 of us are. So on to the next thing. I flew out the day before my mom had surgery, and for the last few days, I've been caring for her. writing down her blood pressures, writing down exactly what medications I'm giving to her, making sure everything is on time, making sure she's eating, thinking about bowel regimens, helping her to the bathroom, sitting with her as she cries in pain, holding her hand, telling her it will be okay, and how much I love her. I didn't think it would be difficult for me, a geriatrician, to watch my parents age. Yesterday, after my mother had been pretty much in bed for 4 days after surgery, I went with her to the medical supply store to pick out the perfect walker. I mean, this thing is awesome. It's maroon, it has a basket, 8-inch wheels, and if anyone knows anything about walkers, the bigger the wheels, the less bumpy the ride. But how wild is that? I just never imagined going to pick out a walker with my mother. She looked so fragile and weak, and yet I didn't see her that way. The store clerk saw her that way. The store clerk saw her as an old woman, and I saw that. It was wild for me to just observe that. As we drove home, we stopped at a red light and we saw a woman crossing the street. My mom looked and she said, "Wow, look at that cute little old lady." I kind of chuckled and I told my mom, "That little old lady is probably younger than you, Mom." Then we both laughed. I sat with her, during the brief moments where she wasn't in pain and asked her questions about her past. I told her that I realized I didn't know very much about her before she was a mother. She said, "Why on earth is that important to you?" I said, "Because, Mom, I know that one day you were young, active, pain-free, had dreams. One day you were 16, one day you were in your 20s, and I know nothing about that time." So she told me some stories, and I could see her face light up. She was reliving her past, not the sad memories, because I kept asking her about good things, but the good ones, and the happiness in her eyes. It was amazing. Lesson number 2, take the time to really get to know the people that you love, especially your parents. Inviting them to talk about themselves can be healing, and there is just a lot of joy in that. I have to keep working on this myself because I get caught up in my daily routines and I forget to slow down and take time for the people that I love. Sometimes the time we have with the ones we love is limited, and we have to be mindful of that. One morning at 5 a.m., she woke up screaming in pain. I scrambled to get to her and get her some pain medicine, an ice pack to help her with her surgical site. About 20 minutes later, as she's kind of settled down, she said, "Wow, I never thought I would be so frail and weak. I never saw myself like this. I used to help patients and I never thought I would be like one of them." I looked at her and I said, "Really, Mom? I think about that all the time." And now maybe that's the geriatrician in me, but honestly, every day I wake up and I am thankful that I am healthy and able to get around. I know that one day I won't be, but that day is not today. I have to take advantage of the day that I have, not only to make myself a better person, but to help heal, to love, to leave this world a better place. Lesson number 3, be grateful for what you have. Be grateful for your health, your children, your parents, your friends. Live a life of gratitude. And I promise, my friends, you will be happier for it. I was asking my sister the other day, I said, "What is one thing that you want that you already have?" I think about that all the time. Finally, the journey of a caregiver is complex. If we have had the blessing to have loved anyone in our life, at some point we may be called upon to care for that person. I think about the challenges that caregivers face, especially caregivers who are caring for their spouse, parents, and their children. For caregivers, be kind to yourself. Know how truly valuable you are. To those caregivers caring for loved ones with dementia, you are angels from heaven. I can only imagine how it feels to care for someone who no longer recognizes you. Don't ever forget that you are angels. As I flew back home, I realized how thankful I am to have both of my parents living and caring for one another. My father is not the typical caregiver. He has really never been able to provide that kind of care, although he's a very loving man. But watching him help my mother has been amazing. Whew, all right. I know this was a little different, but I hope that you found it helpful. Until next time, my friends, share Jerry Academy with someone you love. Thank you. Thank you for listening to this episode of the Jerry Academy podcast. Learn more at jerryacademy.com or follow me on social media for information on future episodes.